Exhibitionistic disorder represents one of the paraphilic disorders recognized in contemporary psychiatric classification systems, characterized by recurrent and intense sexual arousal from exposing one's genitals to unsuspecting strangers. According to the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5, this condition involves persistent fantasies, urges, or behaviors related to genital exposure that cause significant distress or impairment in important areas of functioning, or the individual has acted on these urges with non-consenting persons. The clinical understanding of exhibitionistic disorder has evolved considerably over the past century. Early psychodynamic theories suggested that exhibitionism represented a form of unconscious castration anxiety or an attempt to seek reassurance about one's masculinity through shocking reactions from others. However, contemporary research has moved beyond these limited explanations to embrace more comprehensive biopsychosocial models that consider multiple contributing factors, including neurobiological predispositions, psychological vulnerabilities, and social learning experiences. Individuals with exhibitionistic disorder typically experience sexual excitement from the act of exposing themselves to unsuspecting victims, often in public spaces such as parks, parking lots, or from windows of buildings. The arousal is primarily derived from the element of surprise and the shocked reaction of the observer rather than from any expectation of sexual contact. This distinguishes exhibitionistic behavior from other forms of public nudity that might occur in appropriate contexts, such as nudist beaches or artistic performances. The onset of exhibitionistic disorder often occurs during adolescence or early adulthood, with many individuals reporting their first exhibitionistic urges during their teenage years. Research indicates that the condition predominantly affects males, with female cases being significantly less common. The typical pattern involves episodic behaviors that may increase during periods of stress, relationship difficulties, or other psychological challenges. Many individuals describe feeling a buildup of tension that is temporarily relieved through exhibitionistic acts, followed by feelings of guilt, shame, or anxiety. Neurobiological research has begun to illuminate potential brain mechanisms underlying exhibitionistic disorder. Some studies suggest alterations in neurotransmitter systems, particularly those involving serotonin and dopamine, which are crucial for impulse control and reward processing. Neuroimaging studies have identified differences in brain regions associated with impulse control and sexual behavior, though more research is needed to establish definitive causal relationships between brain function and exhibitionistic behaviors. The psychological profile of individuals with exhibitionistic disorder reveals common patterns that inform clinical understanding and treatment approaches. Many exhibit difficulties with intimacy and interpersonal relationships, often struggling with feelings of inadequacy or social anxiety. Some research suggests that exhibitionistic behavior may serve as a maladaptive coping mechanism for underlying emotional issues such as depression, anxiety, or low self-esteem. The temporary excitement and sense of power experienced during exhibitionistic acts may provide relief from chronic feelings of helplessness or insignificance. Assessment of exhibitionistic disorder requires careful clinical evaluation by trained mental health professionals. The diagnostic process typically involves comprehensive interviews exploring the individual's sexual history, the nature and frequency of exhibitionistic urges and behaviors, and the impact on their daily functioning. Clinicians must distinguish between true exhibitionistic disorder and other conditions that might involve public exposure, such as mania, substance-induced behavior, or intellectual disability. Treatment approaches for exhibitionistic disorder have evolved to incorporate evidence-based interventions that address both the symptomatic behaviors and underlying psychological factors. Cognitive behavioral therapy forms the foundation of most treatment programs, helping individuals identify triggers for exhibitionistic urges, develop alternative coping strategies, and modify distorted thought patterns that contribute to the behavior. Relapse prevention techniques teach individuals to recognize high-risk situations and implement appropriate coping mechanisms. Acceptance and commitment therapy has shown promise in treating exhibitionistic disorder by helping individuals accept their urges while committing to behaviors that align with their values and legal requirements. This approach emphasizes mindfulness techniques and psychological flexibility, enabling individuals to experience urges without automatically acting on them. The therapy focuses on developing meaningful life goals and relationships that provide more sustainable sources of fulfillment than exhibitionistic behaviors. Group therapy can be particularly beneficial for individuals with exhibitionistic disorder, providing peer support and reducing the isolation often associated with this condition. Group settings allow participants to share experiences, learn from others who have successfully managed similar urges, and develop accountability systems. However, group therapy requires careful facilitation to ensure that discussions do not inadvertently reinforce inappropriate behaviors or provide ideas for new forms of exhibitionistic activity. Pharmacological interventions may be considered as adjuncts to psychological treatment, particularly for individuals with high levels of sexual preoccupation or those who struggle to control their urges despite psychological interventions. Selective serotonin reuptake inhibitors, SSRIs, can help reduce obsessive thoughts and compulsive behaviors related to exhibitionism. In some cases, anti-androgen medications that reduce testosterone levels may be prescribed to decrease overall sexual drive, though these medications require careful medical monitoring due to potential side effects. The legal implications of exhibitionistic disorder are significant, as the behavior typically involves non-consenting victims and violates public decency laws in most jurisdictions. Individuals with this condition often face criminal charges, registration as sex offenders, and various legal restrictions that can have long-lasting impacts on their lives. The legal system's response varies considerably, with some jurisdictions emphasizing punishment while others focus more on treatment and rehabilitation. Family dynamics and relationships are profoundly affected by exhibitionistic disorder. Spouses and family members often experience feelings of betrayal, embarrassment, and confusion when learning about the condition. They may struggle to understand how their loved one could engage in such behavior and worry about the impact on their own reputation and relationships. Family therapy can help address these concerns and develop supportive approaches that encourage treatment while maintaining appropriate boundaries. Prevention efforts for exhibitionistic disorder focus primarily on early identification and intervention. Mental health professionals emphasize the importance of addressing emerging problematic sexual behaviors during adolescence before they become entrenched patterns. School-based programs that promote healthy sexuality education and emotional regulation skills may help prevent the development of paraphilic disorders. Additionally, accessible mental health services for individuals experiencing concerning sexual urges can provide early intervention opportunities.